Inside the program this morning, Ready Democracy go talk to the chairman, Interim Transition Management Team, National Emergency Medical Services, the Ministry of Health, Dr. Mustapha Kabba. We go talk about the restructuring the way they don't do, na the National Emergency Ambulance Services and other thing them. Well, with that, we would welcome student guests. Inside 2018, government be officially launched the National Emergency Medical Services, NEMS, where this na part of government's efforts for improve healthcare delivery. Na the country, more especially na the one them we get for do with emergency medical situation them, where they aim na for provide timely and effective pre-hospital care and transportation to patients them, coordinate emergency service na the country. Also they don't they make sure say ambulance then reach na at to reach area them na the country. Well, from that small background they were don't give for names. So and as we also today for talk about the National Emergency Ambulance Services, then the restructuring the one I don't do and other thing them. So before we come to the topic, you know the same way so the Deputy Chief Medical Officer Clinical Services na the Ministry of Health.
Yeah.
So start for give we updates but waiting on the happen at the web body sector.
Well, thank you very much. And I like your updates. I think you don't make me work very easy for me with a good background. In the well body sector currently, one of the big things we do undertake now this spotlight on the district. I sure say people there in this country, the CC, the entire ministry leadership, they go out of U building, they go to the district, go to small communities for really understand the health challenges and try for see how we find solution with the people then they locally as well as the solution they will get the problem they will come with for can solve now the ministry will cow them. So this month the spotlight on the district, what they also call the health train, it in a Moyamba district. We get an opening session, we meet with the stakeholders, we meet with everybody, right? We don't begin visit with health infrastructure, we go to the hospital them, we go to the primary healthcare units, we get talks with the district health management team. Was a very good meeting we don't get, and so far we don't learn a lot, some of we serve within our leadership position, on how we go improve the services for the people of this country. So this is a very good initiative led by the Honorable Minister, Dr. Austin Dembi, of course with full inspiration from His Excellency, the President.
Okay, so waiting at some of the things we una want to achieve at the end of this district spotlight health initiative.
First of all, now for make we get a complete understanding as to waiting they go on. We invest a lot, we do a lot of activities from Central, we come up with a lot of ideas, a lot of projects. Is this one is it really reflecting on the lives of our people? So we go on you really get a tangible impression of how things they go on there, and the people and they give them feedback as to how they want the well body for go on, well body business for go on. Something I know is done at you building or at the leadership for decide not to the right approach, but then get their own right approach where then go help we for make we improve the services so they provide.
This spotlight when I start na Moyamba district,
yes,
go engage with different people. During this engagement, waiting as some of the feedback the way the people engage na, more especially how they want for improve the health sector for say another districts there.
First of all, the people then be glad first of all will come and then get the opportunity first time for talk to the leadership. One of the things that we then mention now, first of all, access to some of the facilities and the quality of services what they provide in some of the services. Some place then they will get infrastructure challenge, they mention them. Some place then they will hard to reach because of the road conditions. So we look at all of this and we forget an interministerial discussion because some of the challenges that we don't see in that place, they're not a Ministry of Health alone to solve them. Like some of the primary healthcare units and in our riverine areas and in our very bad communities where the motorcar safe, the ambulance and stuff will get hard for each day. So the people then they get for struggle before they come to their facility. Then the availability of the essential commodities in some of their facilities was also mentioned as one of the big barriers. One of the things that we then recommend is now for medicine be properly involved. We involve them in most of the activities, but there is some communication gap, especially in the planning of things that we involved in livelihood and in healthcare.
The people then go back so now we get explain some of the things that they want for see and the challenge they get. So Moyamba district when I get somebody they do the head they wanna get hospital and they So in all, waiting at the role and the performance, because the owner go there and the people then go explain to owner some of the challenge them. I wanna go able to rate them in the area of communication between them and the community people.
Well, you see, this is an ongoing process, and the team they we in na Moyamba, we na the district health management team, we na the district medical officer, the head am. Then you do well, right? But you know go be perfect in all ways you do. There are challenges, especially where they don't highlight to we try for work with them for improve on. So this, I think, say on the team where they will meet them, they were well prepared, they hosted us well. They also have some limitations in terms of what they can deliver. So we therefore give them the full support for making them deliver for the people. Yeah.
Okay, so as this initiative now one way on the go na different districts and identify the problem them and know how na go able for solve. And now the trending na more about the districts and are sure so una don't go na different medical and service them. So what are some of the things way una able to identify and how una don't able for solve them thing in there?
Yeah, one of the issues then we especially in Moyamba will notice is that the uptake of some of our services is not to the level we would expect, right? Especially around the hospital. So we get to understand with the community why this be happen. So there was some little bit of misunderstanding between the previous administration and the community. We don't talk to them, we don't assure them for saying now a new management team they inside the hospital. We're ready for work with them in the community. So that issue was also solved. One of the other issues is like there are ongoing renovations and work going on where they also inhibit some of the areas that we say people them for work, right? So then they say for the try for push them so that their renovation and they go complete. With the install solar energy system, right? For bring power supply to the hospital. Then big challenge then get at the hospital right now. The hospital they run on generators, so they get for need a lot of fuel for support it. So sometimes then they get power outages. But with the new initiative of the ministry, or the solarize or they put solar installations in all our facilities, Moyamba they benefit from them. So this is now also a good thing where they happen for improve and increase the confidence for make people then able to come at the hospital and use the services.
Okay, so one other concern again from the paramount chief now that they not get a better medical facility so people go get quality healthcare service. So waiting the ministry don't do in that area for CC Moyamba district get a quality make people begin access quality healthcare service in that part of the country.
Yeah, Carifa, and also you said be by the trip UBC. Some parts of the hospital, like I tell you, say no more under renovation. So them parts then they not able to provide service. So we compress them in some areas, and due to that there are some limitations and they as to how the services then they provide. So we hope that as soon as we don't done within restructuring the renovation, we'd already change the management to get a new management team at the level of the leadership in the district. I should say the service system will improve and people then will come. I don't already mention the solar systems for improved energy supply at the hospital. As we go to the store, you said they will see the store full of drugs, right, and commodities and consumables. We make sure so then commodities then they then go out into the facility, make people then use them well, and we get a proper monitoring and tracking system for make sure so they don't get out of the hospital, but they stay within the health facilities and people then use them well.
Doc, wanna get any plan for do this and spotlight check now other districts them na the country because we be don't start na Moyamba?
Yes, of course, we get for do and other districts them. I think say the team where they coordinate all of this, the next plan where they don't show to win for gonna Kailang. Then after that, another district go come. So it get for be a monthly event where they gonna all the districts in this country and do the same activity for each and every one of them.
Okay, take into consideration because plenty time we're gonna the medical decide and the district medical clinic them you can go so and they say medicine day, but for them go give them out to patients it don't be one big challenge. In that area, the way to wanna think it don't be the challenge because according to you don't explain so we're gonna Moyamba this kid wanna see the story medicine day, but we then can go to patient then the challenge they can will not get this medicine wanna pay for this and this.
Well, we on work now for make sure say we really work with well body work command within the district for ensure say the kind of drugs they will need often then they at the stores and then get to the people and we'll get a proper tracking system for track then drugs then they how they use them and how the people and they get them, right? So the tracking system will be deployed. Now we get some an application what they call M-Supply, where a digital tool where they able help we, even if within a central self na Freetown, we understand with drug distribution, with level of with stock level, and we're able to preempt and predict stock out levels in the facility so that people they not go get a situation where drug they not in the hospital.
Doc, recent the salon begin record the case of the mpox sick, and we don't see how we don't go. So you they had today for giving updates, but the sick as we don't see plenty people don't get the sign and symptoms, and they don't get the sick, or they don't explain it. Tell people say the sick in real.
Well, mpox real. We know say na sickness we dey. Now we country, we don't in other country than in Africa. We say if we don't get them, and of late we statistically show so we got about 111 cases in country, and it's self-limiting in the presentation, but it very people then able catch them. We touch person, we get them. You didn't person we touching skin on our body. It's possible so yourself will get them. So we therefore be careful. Where we see signs and symptoms and also if anybody will get a rash, where they get in crow, where the camp in face and body, make we call the relevant authorities. We get an agency now where the ministry gets, when they handle that area, we are the National Public Health Agency led by Professor Fodesa, and they're very responsive. They get surveillance officers and they work with the community and they ride on the primary health care structures for go out to the communities for really pick out them cases and they one by one, household by household for make them get treatment.
Okay, so who say they only getting 8 people in the day now?
They scatter all over the town, all over western area, rural, urban. We get a few.
Or?
Well, they know we treat few of them in hospitals. As soon as we know that they're not infectious, then they go to home. Then we do home support with them and their families. But the majority of them, now they within a hospital setting because it's self-limiting and they manage them in settings. If you get the right toilet, you get the right space for me to do some form of isolation, we prefer for keep you in a normal community.
From 2018, where President Biobi officially launched the National Emergency Medical Services, and according to the waiting and be set them up, now for say them provide services to different people in the country, more especially when it gets for do with healthcare delivery and all that thing them from that time to now. Before we talk about the restructuring, waiting on the happen at the National Emergency Medical Services.
Thank you very much. Why make we here today? Because we get a transition team where they oversee the activities of a referral system, what they call NEMS, National Emergency Medical Services. Like you don't give a brief background, but we know say over the past couple of months, last year, we had series of challenges with the referral system, and the public was not satisfied with the service what they provide. So as a responsible ministry, the leadership put together a transition team for head and see that the NEMS come back on course for provide good services for the people. The ministry prioritized the referral system as one of the 4 pillars what they look at for improve the health sector. First of all, improving the primary healthcare services, making sure that the service get close to the people. We improve on the hospital services with good quality for address complex cases. But between them two systems, then they get a proper referral network. So now the importance that of NEMS. If person they come up from a home, from the community for Kana Hospital, they forget an ambulance, right? For Kautam on time. And of course, the 4th one are health security. But why make NEMS important is that without this, you're not going to provide this comprehensive universal health coverage what they look at. So the team don't they in existence since December, and they look at how to make this service very efficient in terms of operations, in terms of fleet management and staff management. So some of the things the way this team don't put together is, first of all, more look at the fleet, when are the ambulance then themselves. Because if they're not in the right order, they're not going to respond on time, they're not going to respond also adequately. So the management where currently the head NEMS don't really try for streamline the amount of ambulances that will get. Now strategic locations then for respond timely. Yeah.
So, Doc, before we can talk about the thing I don't put in place, the ambulance them, you say una be get reason waiting make una been say government be decide for restructure NEMS. So waiting are some of the challenge when una been pick law say because of this challenge people only get access to ambulance services then at the country make una been decide for restructure NEMS.
Well, one of the challenge where we get from the public concern is that something they can call the ambulance then they come, something in they come late, or something and there are issues with logistics for maybe the ambulance move. So all of them concerns and it really be very alarming, and we be concerned that no one for make we get a situation where people are going to lose their lives because we know they respond. So as a responsible system, we came in with the transition team for move on with the NEMS management structure.
So who said first when I start as the transition team?
Well, first of all, the management get the mandate for run the whole NEMS operations in the country. So the whole management was asked to be put on hold until their activities are properly looked at and see how which name they do. So the current management, the first thing we start with, first of all, like I tell you so, now the fleet, the ambulance them, then therefore be ready for respond. If they call you the ambulance not ready, no problem. So we don't get a streamlined ambulance system. Of course, the whole country we get about 165 ambulances. We get some of them were faulty, but in operations we get about 65 ambulances where they in operations in strategic locations. Each district get a number of ambulances for respond timely to interventions, and we try to make sure so that we call the NEMS system within 10 to 15 minutes. An ambulance for go for respond and take you person can go side for go. So in that system, the way they look at the fleet, you get to make sure the fuel, we also not a big concern, is available in the ambulances. The paramedics, the drivers, the supplies are also available. We also maintain the ambulances. We don't get a good maintenance system now. Even last week we buy about 100 tires for all the ambulances for change the tire. You know, they go the tire go and puncture on a road, and you can forget another ambulance, right? So if you maintain the ambulances and get them fuel, they're upgraded, you go make sure so them go efficient. Additionally to the fleet, December within this team, the government and the Ministry of Health deploy 14 new ambulances to 5 districts where the President and the Minister of Health were also part of that distribution process. Okay. This is the add to the new number of vehicles that will get for apply the routes where people then get their problems. And apart from the fleet, so you don't get the ambulances that ready, you get forget the place beside people then they call ready. Like if you call now, then you not get positive or response to your call, no problem. So what we don't do, instead of having two and a half stations where they respond to calls, we don't get 5. So you don't increase the capacity. So somebody can jam at the line. If one person they call, 5 people can call at the same time simultaneously. And there is a very good software for triage the patient, for classify the level of injury or the level of illness we then get, for red, yellow, or green, for serious one for urgently respond to, which one you get some time for respond to, and which one of course you can do something else. So that system they in place.
Okay. Okay, so the availability and the response of ambulance now, one we don't be concerned inside the past year them. Also we don't receive plenty video and concern them from people where belle woman can die and save plenty people where can get accidents, can die because of delay for response to ambulance and the availability of ambulance then are there, especially in our rural community them. So how this transition team don't they work for CCA unable for address the area then they?
Well, now the case will be the bill. So if you give me small time, we'll get to that point. I'd even give figures as to the improvement we don't see. Yeah. So what you don't do on the fleet, the other area we not be concerned are the ICT. I don't talk about that. The third area are the human resource. The staff get for be trained on basic life support, for respond on emergency issues, take care of the patients before you bring her out of the hospital. So all that training need to go on. Recently, we conducted training during this transition team with 34 military hospitals, and the British military will be there on emergency services for we staff, the paramedics, and the drivers. If you don't do that, we also they look at UDA for the NEMS system. Some people they're not able to work again. So for pull them, we get new one them. And there is also some areas we need to employ some more staff. So all of that process they on. And finally, waiting we do an independent management review of the entire NEMS system, where we don't get an international consultancy through World Bank for review all waiting NEMS we don't do over these years and come up with recommendations, of course, with we as a ministry, as to waiting at the way forward in terms of waiting this country need for provide adequate referral system for address universal health coverage. So to your question now, I get figures. After we don't put in place all these systems, this transition team within the 90 months don't record tremendous good successes. We're remarkable. One of the things that we achieve is that the monthly referrals, right, they don't increase to about 94%. There were months before the transition where the referrals were around 375. Now, in the record, about 729 per month, right?
These statistics now for all over the country.
Now for all over the country, now from different districts and collated together. And most of these referrals now for Bele woman and Pekin, 75% of the referrals in a woman the way one born, you know, get issues now in communities, we take them to hospital. And definitely we don't see good outcomes after we then go to the hospital. We don't improve on the response time. Before this time, we call ambulance like I yourself BDC, it or something they know they come. So that we response time at that time was 30-45 minutes before they get to the site. But now the response time we don't really measure them. It's about 10 to 15 minutes. So if your injury occur, would it take 5 minutes for deploy the ambulance? They would hope that within 10 minutes if I get to the site of injury, no matter what side the injury occur in this country. So now the aim that we don't get a lot of good results out of that. The aborted mission, that means we call na NEMS, then incident they come. You know, you don't did it, you don't wait 1 hour, they not come. Now then also tell yourself no, will respond on time. We don't stop landing. We don't make sure that you know to TV for happening. We call the ambulance forget. So we don't reduce the aborted missions to about 80%. Yeah. So these are successes we don't achieve during this 90 months of transition due to some of these measures that I don't highlight to you already.
Okay, so you talk say on waiting at the process for call for make possible able get access to the ambulance.
Well, the National Emergency Medical Services, you get a number where you call the call center people, then they pick the phone. We then pick the phone, they tell
waiting at the number where they call
117.
Active.
We call there, then they pick the phone. We then pick the phone, then they ask you what's wrong. We tell them, you put it inside the system gets a software, then it triage the call for see if not acute emergency or not something like it's red, yellow or green, right? So we don't do that now. Then it deploy the ambulance. We deploy the ambulance gets a well-qualified paramedic and a driver. We forgo and address to the emergency and bring them to the nearest facility. And for me, go get treatment.
So this 117 are for all the network. 119
if not for all the network them.
All the network them, yeah.
So people they pay for get access to these ambulance services.
You know the PO not free.
Okay.
Not free service, yeah.
Doc, we producer the try for call the line, and according to producer in the call, they know they pick the call, but to go try and back. The program where they listen to now Good Morning Salon, where they come to you from Radio Democracy 98.1 FM. Inside the program now, not time for Louis. Take break as we producer still they call the 119 line. We, according to Doc, in the active anyhow we call on people and they respond to you. Program Good Morning Salon they continue and they come to you from Radio Democracy 98.1 FM. Well, inside the program now we come to the other studio guest, Dr. Kabba, as you talk, where we go offline just now. Dr. Kabba will make clarification for sake of the number them we give. We were now for the ambulance service in Sena 075 300 400. For sake of this, we don't call the line now. Good morning.
Good morning, Ambulance Emergency Call Center.
Okay, this now call from Radio Democracy. So just want to confirm if this number they work if somebody wants to get ambulance.
Okay, ma'am.
Okay. Thank you. The program they continue and we don't confirm that number there. According to Dr. Kabba, the number is 075 300 400, and if you call them, they get ambulance service. We go come to you. And doc, away from that, we don't confirm the number. One challenge where they don't, because according to a different, you don't have a different challenge. They will say una don't get we make una be restructure this national emergency services. This restructuring gets anything for do it for can change the habits where people only get, more especially the driver them. Now they had to reach area them. If people can call them say we get emergency, the first then they tell you we not get fuel at the ambulance, so whether they can make community people can able for put together and buy fuel and go with them below man in any emergency we then get.
Yes, that now one of the challenge that will be to get as a ministry. We do this right, and now I assure you for say all we stations, all we locations, fuel is available for provide service at any time we call. What we do is that we get a proper fuel management committee where we look at the fuel available and the utilization, and we'll get a fuel tracking system for accountability, so we already know if they give 50 liters of fuel, who's use them, how you use them. This also be regularized by a proper GPS system where the ambulance then they get for know the mileage and how far then they go for calculate the usage of their fuel.
Doc, when I get anything for a tracker when they put na the ambulance motorcar for let people go know, because I remember one time the ambulance they run they come people on get on road where you go they also impact sometimes na call and can load sometimes other person and can load. When I don't wanna get a tracking system for no like the actual thing working inside the ambulance them when a patients for the day.
Well, I don't know for understand. Not to all the ambulance that within this country they under NEMS, yeah.
Okay.
You get some ambulance and they within a community. You know, you get some other private hospitals and institutions that wouldn't get their own ambulances.
But that particular ambulance,
we on ambulances. If anybody see, then they load charcoal. If anybody see, then get passenger. Do you call we make respond on time. We not go to all sides at the same time. But the one that would the monitor, we then get them GPS, we them on mission. They need to carry charcoal or people them for move from one place to the other.
So doc, what is the difference between the two ambulances? Because you see some ambulance they in a private ambulance, some na and they under NEMS when a government own. How possible go able for no say this na this, this na this?
Well, we own the right part explicitly NEMS.
Okay.
NEMS they param. They get the logo of NEMS, but all we own ambulances. Yeah.
Dr. Kabba, part of this transition team, they also look at as this NEMS now for give pre-hospital care before they're able to reach with the patients now the hospital. Waiting are some of the first aid treatments the way on also they give the ambulance services.
Well, the ambulance and for equipped, at least for make where the paramedic get to the site, able to provide basic first aid treatment, right? If somebody bleed, if you're able to manage that bleeding, if you're able to time, if you're able to get tourniquet, or if you're able to get the compression bandages. Yes, the paramedics, they are trained to do that. That is part of their training. They are trained on basic life support and pre-hospital care. That means if we're able to resuscitate the patient, if they need IV fluids, if they need any form of, if they get fractures, you get to mobilize the leg so that bend, so that they align properly until they get to the hospital.
How this transition team don't they work for CC people where they now had to reach area, especially where like ambulance not able for go there una work for CC people self able for una try for amenda challenge where people only get for reach na the CHO then we can na the different districts them.
Well, the challenge for make people then they get access to the ambulances, I think so we don't really address them in a very huge way. Meaning that when they don't try the number or don't give una don't call. If you call anybody, right, even though I not sit down at this
some side in the ambulance not able for each day.
Well, we call, we go no say now place we very difficult and we go find way forget to you. Definitely.
Okay.
We get to everybody in this country. Sometimes some terrain and they of course the vehicle they know they go there. What do they try for do now, like especially the riverine areas them. Would they try for get boats? So that at least them boats then they go able to take the people them from their areas and then bring them to the mainland. From there now, we'll able to use the ambulance for get them on to
Now na time follow we take some messages them. This one they say, you know, it say me na example, it say I be they come out from both to for go free tongue. And the NEMS ambulance I break am, and be they travel with patients, and be put me phones and the patients be they bien. It say they take the patients for going to emergency hospital, as sit down at the passenger seats. Why that's for be?
This other one form is 0779819. They say, thank you, Dr. Kabba, especially for trying to overhaul the NEMS activity. We all should agree that NEMS was and is still facing serious financial challenges, which is the main issue. No matter what you do or say, it will continue to face the same issue if not funded. Since the funding ended, this has been the case. Why is 117 not used as national health emergency line and it is working? If no, why?
And this one they say, Dr. Kabba, just want confirm now you the head na names back because now you na the deputy chief medical officer.
This other one from 077981981 they say, please ask doc why the mpox patients has provide medicine for themselves and not the government by brother has been admitted at the Kinton Police Hospital and the nurses are saying there is no medicine from the government. For now, I have been the one taking care of his medication for the past 2 weeks. So please, doc, comments from Komana Jue.
And this one they say how una they deploy the ambulance them because according to you talk about the different ambulance them. One I don't begin at district them. Whose district and district una can take as priority?
This other one from 077981981 they say Oman Bangura also expressed confidence in acting minister Patrick Jibila and thank his team for their dedication. He also apologized for any offense caused during his time in office. His commitment to Sierra Leone's youth remains unshakable. Hope he will continue serving our nation in capacity. This one are from Mark 10 and New Englandville.
And this other one they say from Tunde Scott, they say the emergency line is just off there. It is not functional at all.
Well, you know, now that's all I get with me.
And the final one I they read now they say when una go get people we go add them name service and make them take into consideration the way and how the ambulance driver then don't they work, because if una see how they don't they work really nice, then can left patients them and say take other people I think say una for increase in salary because I should say now that not the problem. This one they come out from Mohammed. Well, doc, now some of the messages and that's what we read inside the program. We go respond to them.
Yes, thank you very much. I see a lot of interest on the NEMS issue because they're burning issue. First of all, I start with the issue of the funding. The funding stream for NEMS is Government of Sierra Leone. The Ministry of Finance is the main sponsor of the NEMS infrastructure. Of course, there are other partners we Ministry of Health get within the support, but there is always a gap that needs to be addressed. So this independent management review where World Bank they do would really look at what is the sustainable funding source and stream and which amount of funds we need for operationalize this service to provide universal health coverage. In terms of who are the head names, we get an interim management team when I'm in at the chair. I get a secretary and we get an operations officer. The secretary is Dr. Songo Kodoyima. We get an operations officer, Mr. Samura, and you get a finance director, Mr. Samu. We now Mr. Sifoy don't replace. So now this team, the lead on the transition. This is not a permanent structure. After a while, this team get for step out and get a permanent structure for run the NEMS infrastructure. But you need a team like this for put things in place so that this transition is done smoothly. In terms of the emergency line, the 117 line, of course, the health emergency line, with the activator we'll get health emergencies, but we don't communicate. The correct lines are 075 300 400, 033 300 400. These lines, of course, we don't test them now, and then they work, right? You say don't test them, me say don't test them. So I think that one will not get much for talk about that anymore. In terms of the mpox, the drugs, and now where I say people when they buy drugs from any facility, we go for check, we go for cross check with the team, so that we understand waiting to go on at that facility level, and me go on for make the person give me the name of the facility and the time. King Tom.
Yeah.
Police Hospital?
Yeah, King Tom Police Hospital.
All right. And if we can get more details on the patient, maybe later after the show, I would really like for do that, so we investigate and go further into this case. Actually, the patient is not supposed to buy the drugs. Yeah, they're supposed to get it free. The ambulance deployment priority. The government and the Ministry of Health do that based on assessment done in the country. We say the case then the common we need for be referred. Most of the cases where referral they take place for na obstetric woman they will get belly and picking them. So we get some high catchment area. Oh no, say this area there now they then belly woman and they boku now they then can get complications and the need for move. So now then side and they would deploy the ambulances. Then secondly, the other strategy what they use for the deployment is now the response time. It's very important that within 10 to 15 minutes, an ambulance station for this somewhere for respond to whatever emergency. So that is to inform the response. Passengers on board ambulances, like I say, this require with all effort as citizens, more monitor. If we see any ambulance, they take passenger, do your own call with. Now this kind of information we want. Give me the number of the vehicle and the time where this happen. Will it take immediate action for rectify them kind of flaws there, because ambulance now for patient and now for the critically ill, maybe with one or two relatives. Any other person not supposed for sit on day, and they're not supposed for use the ambulance for any other purpose. I think these are some of the questions. I don't know if I left anyone out.
Okay.
Yes.
Okay, Doc. Now the call for in the studio. Waiting could be different from this transition team to the old one.
Well, this transition team gets a mandate, you get a lifespan, right? The old one are like you get contracts, you give people in time for do their work, and they did it for a long time, right? This one a short-term measure, right? So with the day we fix, we move on, and the difference is that you get the opportunity for also implement and work around for develop the independent for supervise the independent management review where they go on for come up with tangible recommendations to government. Look at when they talk about the funding, right? It has been an issue. Do we need to have this amount of fleet of ambulances, right? Do we need to have the amount of staff? Do we need to have this kind of infrastructure around the country to support the referral system? Do we need to expand? How do we integrate all the hospital ambulances within one umbrella of NEMS? So these are all the things where this transition team for do. They get a mandate and strict terms of reference, and where the time expire, then for go away and hand over to a proper system. We go move the referral structure forward for this country.
So the human resource una get them and waiting una go do we go different as you say this transition in team not to permanent, so una go left for say the other one they then go come everything they okay in terms of staff, human resource for work na NEMS.
Well, human resource na thing where you get for build capacity. We dey look around within the system itself and build capacity within the Ministry of Health to get people that were very good and capable for do this kind of work. Out of the ministry also get people. So now the work that they will get right now for really identify competent Sierra Leoneans who are able to do this job. If we not get people that way they up to speed, you get for develop their human capacity, you get for train them, you get for develop their skills and give them the mentorship what they require for me to take this kind of job.
So the number they again, and if the number that way they call them na free?
Yes, the number they again are 075 300 400 033 300 400, and this number then are absolutely free. Anybody can call, you know, they incur no cost, and feel free for call at any time. If somebody get challenged with that number there, do ya a big respond, make you know, because there is no perfect system in the world, right? If there are flaws, if there are issues, if you get challenges, do ya make we know. No, sit down there, you get problems. Say, I don't call and not get. Make somebody know. We get other people that will share the numbers, whether in the operations, whether in the system of NEMS. But we goal now for make any Sierra Leonean, it no matter what side you go able to call and then can pick you up. We get an acute emergency.
Okay, plenty. Thank you. We're joining at the program. And name now Dr. Mustapha Kabba in the Chairman, Interim Transition Management Team, and serving as the Deputy Chief Medical Officer, Clinical Service, na the Ministry of Health. As immediately also for talk about the restructuring them we don't do, na the National Emergency Ambulance Services and other things. And plenty thank you for joining the program.
Thank you too. Thanks for having me.
When I had this edition of the program, Good Morning Salongo left you. Plenty thank you to me producer Michael Sambola with support from Mangi Mansaye and Kabia. Plenty thank you to DJ Sugarcane for in technical support. Fatmata Samoa and Jaffa Mans Davis we make una watch we live on our Facebook page.